kind introduction. Can everybody hear me? Yes. The mic is working? Fantastic. So you stole all of my fun facts about myself.
I do that, so I got to stop.
It's totally fine. We'll just go into it. So the goal of my research is really to try and understand how can we design, build, evaluate, deploy technologies for underserved communities in ways that help them to overcome global challenges. And I'll unpack what this means shortly. In a nutshell, I work in two different fields of computer science and information science. One is called Human-Computer Interaction, or HCI, and the other is Information and Communication Technologies for Development, or ICTD. Remembering these acronyms is not important. I sometimes forget myself. What is important is that the work that I do really has three main components. The first is that I try to do projects or have students work with students who do projects that are trying to tackle global problems in some way. So we're not working on things like how can we deliver pizza faster. I know it's a very important problem in New York. We're working on things like poverty, education, literacy, health, some of the most pressing challenges that humanity faces today. And for me, it's trying to understand how can technology play a role in addressing some of those challenges. We try and work on these challenges in places that are extremely limited in terms of the infrastructure and the technology available. So there might not be internet connectivity in a lot of the places that I work, there might not be electricity even, or transportation, roads. And then finally, I work with diverse communities. So people from different cultural backgrounds, different social backgrounds, different political backgrounds, across the world and here in the US. And I'll talk about those in a little bit more detail. And in combining these three components together, the most important thing that comes up in my work is that it's not really about the technology. We can build technology, sure, but unless it actually works for the people who are trying to use it and helps them to solve the problems that they face in their lives, the technology is really going to be useless. And so we really need to focus on the people, and that's where that human-computer interaction comes in, where it's about the humans and the technology and trying to combine them in ways that can address some of these challenges. When we think about the kinds of people that we might focus on, there's really three different categories that I work with. The first might be individual people, regular citizens. In this case, a rural farmer in India who's trying to sell their goods on the side of the road or at the market. Then there's what we call intermediaries. So these are people sort of one step up, whose job it is to provide services to individuals. So we might think of teachers who provide services to students. We might think of health workers, in this case, who deliver health services to communities. I also work with home care workers in New York City who deliver services to people within their homes. And then finally, I work with organizations. For the most part, for me, these are nonprofit organizations, humanitarian organizations, whose mission it is to try and work with these communities and have some sort of positive impact. And building and maintaining these sorts of relationships is a large part of what I do and what I spend my time on. And you'll see that hopefully illustrated in some of the projects that I discussed today. When we think about the technologies that we focus on, perhaps unsurprisingly, the big thing that people have access to today are mobile devices. This might mean smartphones, it might mean tablets, but in a lot of cases it might also mean more basic phones, feature phones, particularly in rural places like India or Kenya. There's a lot of people who don't yet have smartphones, and so we really need to go and work with the communities, figure out what are the devices that they have, and then design technology for them. So the approach that I take is to really start with the community, go out and do field work to talk to people, analyze the whole ecosystem, understand who the stakeholders are, what are their lives like, what are the challenges that they're facing. I then spend time with my students iteratively designing and building new technologies that address some of the things that came up in that field work. Once we have some tools or technologies that we think are going to work well, we do deployments, often long-term deployments. Many of my deployments span a year or more. And in doing these deployments, I partner with organizations to try and make sure that they also have some on-the-ground support. So I don't just show up in a country and randomly stay there for a long time. We partner with existing organizations who already have infrastructure on the ground. And then hopefully, if all goes well and we do this basic research that shows the technology is able to improve some outcome, we then have this handoff and broader impact where we either release the tools for public use or we integrate them into these organizations' tools. Most of my work is free and open source, so I give away the software so that it's publicly available for everybody. Unsurprisingly, in many of the contexts that I work in, paying for software is not something that people are able or willing to do. So my goal is to now illustrate this approach, and I'll talk briefly about 3 projects. I'll touch on 2 really quickly, and then spend most of the time on the third one, which is a relatively new one for me. So the first one I'm going to mention was a project that we did that was trying to connect pregnant women in Kenya with health services through a hybrid computer-human text messaging service. So the challenge here is that pregnant women in Kenya don't have access to good health services. If they want to go to a clinic, they have to stand in line for most of the day, miss a day of work, travel a long distance. And so they end up just not going to their antenatal visits and not going to the clinic to get checkups. And so what we wanted to do was to really try and understand, can we deliver information to them through some automated messaging service, but in a way that gets them to respond and ask questions and engage with a qualified nurse. So they were able to have those conversations without needing to spend the entire day waiting in line at the clinic. So this is an example of a message we might send to a pregnant woman. The name would be filled in with their name and the nurse would be filled in with their nurse. So it was personalized. And this one particularly says, iron helps carry nutrition to your baby. If it is low, you feel tired. Are you taking iron or do you need tablets? So in this case, the messages are personalized to the stage of pregnancy. So as the woman would go through a pregnancy, the messages would adapt based on what she should be experiencing or thinking about. And we added these questions that I've bolded here at the bottom to try and prompt that engagement, to prompt them to respond and say, oh, I am taking them, or I'm not taking them, or I need them, or some communication like that. We did a year-long deployment of this, where we did a trial with a bunch of, I think it was 100 women in an experimental group and 100 women in a control group who did not get the messages. Over that year, the system itself sent those women 3,661 messages. They sent back close to 1,000 messages, which we then categorized. And we found a lot of really interesting things. One was that many of the messages that we sent did prompt engagement and resulted in questions that were not related to the message we sent, but were other things that were on their mind. So we would say, do you need iron tablets? And they would say, no, I don't need that, but I have this other question. How do I get to the hospital when I go into labor? What should I take with me when I'm going to give birth? So we were really pleased to see that level of engagement. And perhaps more importantly, we were very happy to see that the women engaged at the critical times during their pregnancy. So as they got closer to the date at which they were supposed to give birth, the amount of engagement went up, they sent more and more messages, and then right after giving birth, they sent messages, and then it tapered off. So it was really nice to see this support that the system was providing them at the times at which they really needed that information. And to have that qualified nurse be able to respond to their questions with medically relevant information and give them that extra support. The next project I'm going to talk about was a different country, different population. So that first one, targeting the pregnant women themselves, was more those individuals. This one is targeting community health workers who are now those intermediaries that I was talking about. And particularly, we were trying to support community health workers in India by giving them personalized visualizations about the work that they were doing. So to set the context here, community health worker programs in a lot of other countries, not so much the US, I've discovered, are government-run programs in which they recruit people from the community. They give them some amount of training, usually 3 or 4 months, and those people are then responsible for going out in their community, often going door to door, and delivering basic health services, things like immunizations, things like pregnancy advice or counseling, basic medications. And so having that community health worker go around their community and visit all of the people and identify the pregnant people or the sick people or the people that need services is critically important to being able to give those communities access to health services. Unfortunately, there's a lot of research that has shown that these community health worker programs, although they can provide very, very positive health outcomes, they're very difficult to run. Mostly because the health workers are in remote places in their community, they don't have a lot of training, they don't have a lot of support, supervision is very expensive, there's often not very much infrastructure there. And so over time, they stop making as many visits, they stop going to see people, their motivation goes down, their performance goes down, and the community is not getting those health services. So the idea behind our work was to try and take some of the data that they were already collecting from their patients. When they did a patient visit, they would collect who's the patient, what do they have, what's their name. So we would take that information and we would aggregate it and summarize it and then provide it back to them in ways that motivated them to do more work. So as an example, this is a visualization that we might show them. You can see in this case, it says, this is everyone's performance for a particular month. The bars are individual health workers, with the blue bar being this particular health worker whose graph this is. And so they were able to see kind of how they were doing in comparison to other health workers in their group, which introduced, as you might imagine, a small amount of competition, right? They were like, how do I get to be number 1 at the top of the list? It would also repeat the information a few times, so you can see it says of 22, 15 pregnant clients were visited, and then it's got all those pregnant women at the bottom there colored in. This was because many of these health workers are actually low literate, and so reading the information or understanding some of it was challenging, and so we had it graphically depicted as well as visually depicted and in text. So repeating it multiple times helped overcome some of those literacy challenges. So again, we did a year-long deployment of this system with 142 health workers in India. Many of the challenges that we had to overcome in both designing the system and in deploying it were these literacy challenges. There was very poor internet connectivity, so they needed to be able to send that data and get it back. And so we actually also implemented a voice-based system where they could hear the same information but by calling a number on their phone, which did not require internet connectivity. They also didn't have very much experience with technology. They did, for the most part, have basic phones, not smartphones, and so we were limited in the kinds of sophisticated visualizations that we might provide. And then there were supervisory challenges, so it turns out somewhere in the middle of our study, the government forgot to pay them for 3 or 4 months, and so motivation went down anyway. But fortunately, we had set this up as a controlled trial where we had a control group and a group that got the visualization, so both of them went down and both of them went up. But over time, our system resulted in them making 21.5% more visits to the community than the people in the control group who did not get the visualization. We also received a bunch of really interesting feedback. Unsurprisingly, most of them were like, tell me who's in my group. I want to know who I'm meeting. I want to know who's coming after me. We did not do that, mostly because we didn't want to create more and more of a vortex of competition, and also because the partner organization didn't want that. But moving forward, we're really interested to try and explore these dynamics a little bit. So you might think, instead of competition, how can we promote collaboration or teamwork or other things that might be better suited to telling them who everybody is rather than competition. So those are two of the projects that I've done globally. But I want to actually spend most of the time doing this talk on a more local project that I've been doing with New York City over the last 2 years. And what we're looking at is tech, privacy, and safety in the context of intimate partner violence. Intimate partner violence or domestic violence, these words are kind of interchangeable. I will talk about intimate partner violence or IPV. Intimate partner violence is a huge societal problem. The numbers in some of the reports that come out about this are staggering. And certainly there's been a lot of media attention around things like Me Too movement and general sexual harassment. But in terms of intimate partner violence, the statistics from the National Intimate Partner and Sexual Violence Survey a few years ago suggest that 1 out of 4 women and 1 out of 6 men will suffer rape, physical violence, or stalking by an intimate partner at some point in their life. It's a huge number of people. And so what we wanted to do was to sort of say, okay, well, as digital technologies play a bigger and bigger role in our everyday lives, they also play a bigger and bigger role in intimate partner violence settings. But so far there's been no work that really looks at how technology is being abused to hurt people, or how we can do things that prevent technology from being abused in ways that hurt survivors of intimate partner violence. So that's the goal for our research, is to firstly try and study how is technology being used, what is going on, and secondly then design new tools or redesign existing tools in ways that better protect victims and that improve safety and well-being. So to do this, we've been partnering with the New York City Mayor's Office to Combat Domestic and Gender-Based Violence. They just changed their name. They used to be the Office to Combat Domestic Violence, but we're trying to talk about it in the new thing, which is why it does not roll off the tongue very easily. And they have family justice centers that they run in all 5 boroughs of New York. And we've been working with those family justice centers, so we've been out doing field work in all 5 boroughs. And specifically, we started with a qualitative field study where we spoke with 39 survivors at these family justice centers and 50 professionals who work with them in a very diverse range of settings. So lawyers, policemen, caseworkers, social workers, all kinds of advocates, and to try and understand what are the things that have come up in their cases, in their lives, in their situations, and how has technology played a role in that. Just to mention, many of the clients, as we call survivors, they're clients of the Family Justice Center. So when I say client, I also mean survivor, I also mean victim. Many of them are desperate for any help regarding the technology abuse that they face. And this client in particular told us that the reason she came to our session is because I'm hoping to let people know my story. Maybe this is going to help somehow to help another person who is going through the same thing. So many of them were really enthusiastic about sharing their stories in the hope that somebody would pay attention to these technology issues that are coming up. So I'm just going to start with a particular client story, and it's not very happy. I will give you some warning. So this particular client said, I was raised in a country in which women are trained to serve men. I'll say that he never hit me, basically, but he did the worst thing ever. Honestly, I would probably rather he hit me instead of the things he did to me. So he put a spyware in our computer. Obviously, I didn't know because he studied computer programming, so he was very savvy about it. He went into my computer, he got my Facebook password, email password, and he shared naked pictures of me. He sent them from his Facebook to my bosses. He took my phone and he sent them through private messages to my friends, but also through my email and my Facebook because he had the passwords. The embarrassment that I went through, the public humiliation, it beat me to the ground. So these are many of the stories that we heard, and this one is intended to be showing a couple of different things, and we've been very careful to modify language and so on in ways that people cannot be individually identified from these kinds of stories. All of these things came up many, many times in our data. This is no exceptional case. But you can see a lot of different technology-related problems going on, right? So firstly, shared ownership of devices. So if you share a computer, that gives the other person access to that. And so using shared ownership to install spyware, for example. Another is compromising accounts. So like a Facebook account or a Gmail account, and being able to somehow get the password, either by demanding it or by guessing it, or because the password was shared at a time when the relationship was in a better way. Non-consensual intimate imagery, which is the technical term for things like revenge porn, any kind of naked image sharing. Device compromise, so not only account compromise, but actually taking the device physically and being able to do things with it that the victim cannot control. And then impersonating the victim to their family and friends in ways that are intended to damage their reputation. So these are just a few of the things. I think we came up with something like 44 different attacks that happen in terms of technology abuse. But this is starting to hopefully give you an idea that abusing technology is a huge part of IPV and really needs more attention from technology experts to try and address some of these concerns. In trying to cope with these things, we definitely found that both victims and the professionals that they work with don't have enough tech knowledge. They don't feel that they have enough tech knowledge. Most of them considered their abusers to be more technically savvy than they were. And the professionals are trained not in technology, but in legal or social work. And so they don't have the sufficient knowledge, or they tell us they don't have sufficient knowledge to be able to cope with these particular kinds of attacks. Many of them would say essentially they end up Googling it, which we term they Google as they go. So they are just listening to a client tell them a problem, they go to the computer, they Google that problem, and they try and, on their own, diagnose and determine what to do. For us, as sort of computer and human-computer interaction technical experts, we noticed that many of these attacks succeed because they upend the way that we think about computer security today. Most of these attacks are different than an attack from a random hacker online. When we talk about threat models, so threat models in security will specify who are the victim and the attacker. In this case, the victim is the client or the survivor, the attacker is the abuser. And then what are the attacker's capabilities and goals? And so we developed these threat models to try and understand what was going on. And what we saw was that a lot of the time, people would say things like, he or she asked for my password, and I wouldn't give it to them, but eventually I had to, right? And because it was either I'm coerced to, or I'm threatened with physical abuse, or all kinds of reasons, eventually they were able to get access to my password. And so conventionally, when we think about these security threat models, in this green box here, normally we think about a strange attacker far away, somewhere on the internet, who's using remote tools or fancy techniques to try and access your accounts. In intimate partner violence, the attacker is somebody who often has physical access to the device, who can demand the password and therefore get access, or guess the password because they can answer your security questions because of that intimate relationship that they have with the victim. And so this really takes everything we do in terms of passwords, which is the main security mechanism that we have, and throws all of that out. We also saw different attacks where people were dealing with fake accounts. So it was very common to set up, for example, a fake Facebook profile and then use that to abuse the victim. Trying to figure out what content is abusive. So in a lot of cases, clients would go to Facebook or Twitter or Instagram and say, they're posting abusive content, can you please take it down? And the platform would go and look at the content and they would say, this isn't abusive. Right? Because the abuser was manipulating my content in ways that were not threatening to a random third party, but that were very threatening to the particular client, either by showing their children or by showing particular items. We heard one story of guns and so on in which it would not be flagged by the platform, even though it's actually very threatening to the victim. We also saw a lot of concern about escalation. So this being, as you try and block the abuser from getting access, they're more likely to come and stalk you and do those sorts of things. So when people separate from their abusers, they lose that control that they've had in the home, and so they start turning to technology in ways that will then give them back that control. So location tracking, various other kinds of stalking or harassing, calling, texting, and so on. Very interestingly, we also saw that some victims actually want to maintain communication with their attacker, in part because that gave them insight into their state of mind. Right? So if I'm communicating with him, even if it's very occasionally, then I know that he's not going to show up at my doorstep. He's not going to suddenly show up at my work. Right? I can manage that in a way that makes me feel safe. So a lot of the obvious solutions that a caseworker or you or me might suggest, things like, well, just get rid of your account, just shut down Facebook, just throw away your device, don't actually work because of these complicated contexts, right? So we might suggest shutting off contact with the abuser, getting a bunch of new devices, just don't use social media. In many cases, you can't cut off contact with the abuser because you're legally obligated to share custody of children. So you have to be in contact with this person. And often the children actually provide another access point through technology to be able to track what's going on. You can't just get new devices because in many cases there are things like family plans where everybody's device is on the same plan. And if you take that away, you're going to have to get your own new plan, and many people can't afford that. And then you don't really want to just shut down social media because that's really your only access, in many cases, to social support from friends and family. A lot of the victims we spoke with were from other countries and their family was in another country, and social media was crucially important for that support. And the research has shown that having that support as you try and cope with a situation like this is really very important. And so you don't want to just cut off that access. We also, as the story that I shared with you suggested, we ran into a lot of spyware problems. And in many cases, these were things that were happening that people didn't quite understand. How is he finding me? He always knows where I am. I don't know how he's doing it. We had one person tell us at a shelter, an abusive partner kicked in our front door and wound up in the lobby of our building by tracking her phone. It was some secondary application that the abuser had put on her phone and knew exactly where she was. He literally kicked our front door open. We called the police. It was scary. So installing these sorts of spyware applications on victim phones is a very common way to try and get additional access. And when we looked at this in more detail, we found that the state of the art for detecting this kind of spyware is pretty much non-existent. People would use heuristics like, my phone is very hot, the battery is draining faster than it should, maybe that means I have spyware, maybe that I should do something about it. Some sort of glitch on the phone was another one that we heard, or this was the only way that the person could have known the information that they've known. The only way they could know this about me is if they had access to my photos on my iCloud account. Occasionally we found that people would go to, for example, the Apple Store and request help from them. Most of the time this was not actually helpful, and it's often not a good option for many victims, in part because those Apple company store employees are not trained to deal with such situations in ways that are necessarily safe. So uninstalling the spyware or cutting off that access might cause an escalation that could put the client in physical danger, and so they might not actually help in ways that they think they could. There's also no prior research investigating the spyware problem at all in IPV, and so we went ahead and did the first ever study of this ecosystem. We built a machine learning pipeline that I'm not going to talk about, that basically identified roughly 4,000 apps that we call relevant IPS, the S now being intimate partner surveillance. And many of the apps were useful for abuse. There were two main categories. The first is overt spyware. So these were things that are intended to be spyware, intended to enable people to track things or listen to the microphone or have access to your file system. But we also found a lot of things that we call dual-use applications. Dual-use applications are mostly available from the official store, so the Play Store or the App Store for Apple. Many of them have a legitimate use. These are things like Find My Friends or apps for tracking your children, parental control, but they can be easily repurposed by abusers to instead track their victims or control and monitor their victims. And so this is a very big complication that we have to be able to deal with. But in short, what we found is that this whole spyware ecosystem is empowering abusers and failing victims. And so we've really set about to try and solve that. So we first looked at how are abusers finding this spyware, and we found a lot of different ways, right? So they are spying through blog posts. There's a lot of blog posts that help people find or track their spouse's device without touching it, right? Video how-to guides for how to do this, ads for spyware applications, and other various spy app websites. We also found a lot of mobile applications. If you just search on the Google Play Store for things like Track My Husband, we found a lot of things that were being suggested. Don't worry, we've also worked with Google to change a lot of this now, so it doesn't exist anymore. We definitely found that some app developers are actively promoting intimate partner surveillance, so these are publishing these resources that are specifically for abusers to be able to do this, which is obviously bad. Others are not necessarily active about it, but are condoning it. And in this case, what we have is some website that's trying to catch cheating spouses, and that is actually only linking to something that is, suggesting that it's a legitimate parental control application. So, when the government goes and says, what do you do there? Oh, we do very nice parental control, but actually there's all these sites out there that advertise that as spouse tracking. And then we found a bunch that were paying for these ads, right? So paying in some way or another to have Google show their particular application. Again, parental guardian is a good one. Surveillance and mobile security, things that sound legitimate, but that can actually be used for bad reasons. We also did a very fun little experiment in which we then called a bunch of these companies and posed as an abuser. So we did 11 in total. And we basically said, can I use this to surveil my partner? Can I use this to do IPS? We got 9 responses. 8 of them helped us do the surveillance. Only 1 of them said, no, our tool is not intended for this kind of illegal activity. Okay, so we would sort of say, if I use this app to track my husband, will he know that I'm tracking him? And they would say well, here's how you can set it so that he doesn't know that you're tracking him. So this was very troubling indeed. We then, as I said, so we communicated this to Google. A lot of this was done through the Play Store, and so we disclosed some of our findings to them. And they were able to take a bunch of action to improve a lot of this stuff, so tightening enforcement around the advertising that was allowed, taking action against videos, those how-to guides and so on, having extended restrictions on certain apps, tightening up their Play Store policies to prevent this. However, those dual-use apps I was talking about, many of them do have legitimate purposes, and so they should be allowed to remain on the Play Store. We just need better ways to detect when they're being used for bad purposes rather than for those intended purposes. And so that's what we're doing now. We have a lot of ongoing studies. We're building tools. We have a spyware detection tool, in fact, and we're in the middle of starting a field study in which we're actually going to those family justice centers and scanning people's devices, searching for spyware. So that's up next, which is very exciting. We're also then redesigning a bunch of these things to try and empower victims in ways that detect automatically when an abuser is accessing an account rather than the legitimate user, for example. And then we're doing a lot in the way of developing a technology clinic modeled after things like pro bono legal clinics, where victims or survivors can come and get expert tech advice from a technology volunteer who will be able to help them go through their devices and diagnose where compromises might be occurring and so on. So we see this as really a cornerstone of our research for the next probably 3 or 4 years, and this is a lot of what we'll be doing with New York City. And with that, I will take questions.